Hi, I'm Jeff Gopin, Chief Operating Officer of Jewish Home Life. I'm here with Dr. Jackson. Dr. Jackson is the Medical Director for the William Bremen Jewish Home. We're here to talk to you a little bit about COVID and how we have dealt with this current COVID crisis in the nursing home.
So yes, if we have somebody that's diagnosed with COVID, we put them on a close monitoring program where every shift or every 4 to 8 hours, the nurses are taking vital signs and being very cognizant of what's going on and any changes that may be happening in the resident. If there is a desaturation, if the oxygen level goes down, or if they have a significant change in condition, then according to the family's wishes, we may choose hospitalization. Some people do well for a period of time and then they have an acute change in condition and then we have to act. Some families have chosen to go on hospice and we've honored that, taken a comfort measure approach. Some families have wanted to be more aggressive and have chosen hospitalization, and we've honored those wishes. The more aggressive treatments really have to be done in the hospital because they have access to those drugs that we don't have.
So Doc, how quickly can things change?
I've had a lot of instances where somebody was doing quite well and we thought they were doing well. They had COVID for a week, sometimes 10, 12 days. And we thought we were getting to the point where we may get out of the woods, and then we had a sudden change of condition. Usually that change of condition is hypoxia or the oxygen level going down, but it can change very, very quickly in the matter of minutes to hours, to answer your question.
Thank you. Doc, what is the home doing right now that gives you confidence in the protocols and in the way we are managing the various COVID cases?
I think that the most important thing is testing. We've been able to identify cases in staff members very quickly. It's the best supplied nursing home I have seen as far as quantity and availability of PPE from day one, even dating back into the spring when all of this started. Our isolation protocols have been very prompt. We take people that we recognize as positives, we keep them isolated, we make sure that our staff has on full PPE, meaning protective gear, N95 masks, face guards, gowns, gloves. It looks like our staff is going in these rooms with a spacesuit on, really, and that limits the spread to staff and limits the spread to other patients. And I think we've done everything in our power to prevent spread once we've recognized cases.
So Doc, when someone tests positive in the building, a resident or a patient, what should the families expect as far as hearing from you? And I can talk a little bit about hearing from the organization itself.
Well, for the last several weeks, I know that the families of positive COVID patients have been contacted daily by our nursing staff. As far as clinical staff, doctors and nurse practitioners, we're contacting at least once a week. I'm speaking to a great number of my patients' families once a week personally, and a nurse practitioner, Chad Harlan from Optum, is also doing that. He's taking care of some of those cases that are also on Optum, and also delegate authority. I've got some patients that are on hospice with Weinstein Hospice, and Weinstein Hospice is taking care of the communication with those patients' families. So between the hospice, the nurse practitioner, and myself, we have been talking weekly with everybody, and then the nursing staff filling in the gaps every day. Right. And I know we're having help from Kara Gold, nurse practitioner, with communication also on the weekends. So we're going out of our way to keep families updated. I think that is important because I know there's a lot of anxiety and stress around this. Well, I know we can't promise that. I'll never make a promise that I can't keep. I mean, it's COVID is everywhere. It's full on assault at all times, and we are trying to ward it off the best that we can all the time, but we can never guarantee that it won't happen again. I think we can guarantee that we'll do the best we can to prevent it from happening again. And you know, we're doing the testing protocols that are required of us, which involves weekly testing of all of our staff right now. And I think that is quick to recognize any cases and remove them from working in the building. That limits but does not guarantee no spread in the building. Of course, like I've said, the PPE, the isolation protocols that we have in place all minimize the risk but do not completely eliminate it.
We are meeting and beating all of the Department of Community Health, CDC, and CMS guidelines that have been put out. And when I say that, it's evident because in several cases we've already had the state in doing special infection control surveys, which they've been doing since COVID. And in both of those surveys, we've had 0 infection control deficiencies. I think that's important to note because they're specifically coming in and they're looking for deficiencies. And it speaks to what you've already talked about, which is just following the protocols, the PPE, but it also speaks to hand washing and sanitation, the way people don and doff gowns as they enter different areas, including gloves, masks. It speaks to infection control from a housekeeping standpoint and how we are constantly working on keeping the environment as clean as possible with our housekeeping crews. They are doing significant hand spot treatments with antivirals several times a day around the units that have COVID. They also clean areas where any of our staff might be touching on a regular basis, such as elevators, bathrooms. They continue to also do spraying with an outside company. We have a company that comes in and does fogging of the entire building. We do that in all of our buildings once a week, and we increase that to twice a week with COVID. So we continue to hammer away at making sure that the environment is clean and infection-free as much as humanly possible.
We'll continue to do what we can and do the best that we can and hope for the best outcome. And I think that the good news is that these vaccines have been put out, and hopefully we'll get approval in short order, and we will have access to them and be able to vaccinate our vulnerable population and hopefully move forward with our lives in the near future and get back to normal as fast as possible.